Okay, good morning, everyone. We're here today to give a little update and the process of what's going on and the happenings here in Monmouth County in these very difficult times. I just want to state here and state very strongly the priority remains safety of our residents and our employees here in Monmouth County, and we are taking extreme measures to try to facilitate the proper protocol and initiatives here with both of those types of individuals, our residents and our employees. I also want to state here that we took another approach with our other 53 municipalities and partners here with our partnership, because this is a true partnership as we talk here of all of us staying on the same message, working together, moving forward with the same process. I think that will facilitate a remedy, I hope, to Monmouth County a little quicker than maybe we'll see in other areas. As I stated before, there is no crystal ball. If I was to stand here, if the individuals behind me and by the side of me were to stand here, they would say the same thing. And nobody, I think, could say anything different. This is unique. We hope we never see this again. We've been through many disasters here, as I stated, through Sandy, through 9/11, through Irene, and here. And each and every one, detrimental and devastating as they all are, we're addressing one head on right now. We took some of the proactive approaches with this epidemic. The emergency declaration that I signed yesterday, along with the Sheriff's Office and OEM, gives us the access to county facilities, activate the staff in the County Emergency Operations Center, and utilize county employees where needed, including assignments outside of their normal work locations. With public safety in mind, we have decided to continue to suspend all public access to county buildings, programs through April 3rd. This includes all Monmouth County Library branches and the Monmouth County Park System branch buildings. The Monmouth County Division of Social Services will accept clients in the reception area where precautions have been put into place to ensure there is no physical contact between Monmouth County employees and residents seeking services. We are implementing alternative work plans for Monmouth County employees. We will start that next week. So our employees know that part of our process here is three-way. We're working for, obviously, the residents, our employees, our business world, and make sure that each and every one are safe, but still can operate to assist each other. We know that this pandemic is not only affecting our workforce, okay, but is also affecting our businesses. We will continue to work with our legislators to get the information out there that is needed for our small businesses. This will, and we all hope, will go away in a period of time here if we do the right thing as a group. But we have to realize the aftermath of this, of our business world, is going to be long-term. So we have to put that in place, this being first and foremost, okay, to cure this epidemic that we have here, but have the tools together to move forward for what ultimately is going to hit us second phase. And I will continue to work, but we have to take some feel-good little stories together and move forward to let them businesses know we're talking to them. We know they're feeling there. And, you know, just a little thing that Tony Perry and a few of us did yesterday, the mayor of Middletown, with Takeout Thursday. Make sure those initiatives are put in there so we support our business world. We need to keep those doors open as long as we possibly can, and maybe never close them if we don't have to, okay? But the right initiatives have to be put in place so that social distancing is in effect. There's going to be many, many, many changes as we move along. This will not be our last press conference. This will not be the next time the sheriff pops up and gives us his plan. Deputy Director Sue Kiley does, Chris Merkler does. We will continue to be on the forefront here to give the information and convey that information. I will tell you, and I know I'm going to say this, and I might annoy some of our other counties when I say this, but I am so proud of our mayors here in Monmouth County because we just left a phone call, probably the fourth one through this has all started on a regular basis. so that we were on the same page and working together. And, keep that in mind. That's 53 municipalities working together for the right reason and for a consistent, focused mission together. And that's the key. Working together, knowing that our county resources are there for them. We are going to do everything outside the box to supply and provide resources to our municipalities. And they know that. And they trust us to do that. So with that being said, and I'll continue and I'll close this out in a little bit, but I want to bring up a few people to give you some other initiatives that we're moving forward. Deputy Director Sue Kiley.
Good morning, everyone. I want to talk about, first of all, thanking our departments. Our departments are doing a phenomenal job, and the Department of Health and Human Services in particular, those employees are working around the clock, and they're redeploying to areas within the government where we need the most help, so on helplines, et cetera. And I really commend them for the hard work they're doing and the commitment they're showing to making a difference in our county. The best defense that we have against the COVID-19 virus, as I've said before and as you all know, is being diligent with respiratory hygiene, with washing your hands, covering your mouth and your nose if you sneeze with your sleeve, and staying home if you're sick, staying home with your families. That's your best defense. I have to say, I was in ShopRite yesterday, and I was amazed at the respect people were showing to one another in keeping a 6-foot distance as they walked through the store. That's tremendous, and we have to keep doing it. It makes a huge difference. Again, for the most accurate information on what's happening, you can call the CDC. They have a hotline, the New Jersey Health Department, and the Monmouth County Health Department. We've received a lot of requests for a breakdown of numbers of COVID cases within Monmouth County. You will begin to see that in our press releases and on our website. In addition, the Health Department has a hotline available for anyone that needs to call in for information on COVID, and that number is 732-845-2070. We are very much aware of the stress and anxiety that this is placing on our residents and, as our director said, on our businesses. We have parents staying home to work at home, and now they've acquired a full-time second job, and that is educating their children. Please, please take advantage of the hotline, because we do have crisis management people on the line that can help you talk through issues you might be dealing with in your home or with your children. Your children are very aware that this is a different environment for them. We have to help them deal with the stress as well. And taking time to talk to them, limiting their time watching the press conferences and the press releases on TV could make a significant difference in helping them to continue daily living. Lots of exercise and doing things with them that are fun. Please make sure that if you need the help, you reach out to the helpline and say prayers. Pray for our emergency workers who are working so hard to make sure that we can curtail this virus as quickly as possible, and pray for those that are already suffering from the virus that they recover quickly. Thank you. I think I'm turning this over to you. Okay.
So last Friday, when I was, and I had my press conference, and I had a lot of uncertainty of different avenues that I had there was challenges that we talked about. And some of them, at no fault of anyone, is the way that things are structured here in the county with our health departments. As you know, and I'll repeat again, we provide for 28 municipalities. As I stated before, with 53 municipalities here in Monmouth County, that puts a little bit of a challenge. Challenge is getting the information filtered and funneled to a direct channel. And I want to say that after putting this in front of our legislators, we have found out that is starting to be structured. And I know a lot of people have a lot of questions about the test site that people are hearing about through the media and stuff, and we support that. We support any involvement of the ability to test our residents here in Monmouth County. But I think it's proper for me to pass this on to the sheriff to explain his initiatives and the work and the dedication that his staff is doing. And I will tell you this. I couldn't tell you how proud and safe as a resident of Monmouth County to say that these people here are behind me, because I'm watching day to day, hour to hour, what they're doing, and through my administration in the county and all the workers there. So as I sit here feeling a feeling of security because of the leaders that we have behind us, I want you to feel the same. And with that being said, I'm going to turn it over to Sheriff Golden.
Thank you, Freeholder. So first and foremost, we want to thank all our healthcare professionals out there who are working so hard in our hospital systems and in our private sector to be sure that our residents here are receiving the best care, and certainly testing is available for them. Also, our first responders, by far, Freeholder, as usual during a state of emergency, they have risen to the occasion. And our volunteers, you know, a lot do not know this, but our EMS structure here in the county for emergency response is built on the backs of volunteers. So they are leaving their families to answer the call every day. I do want to also acknowledge our maintenance staff is the unsung hero here in the county. Bob Compton, Buildings and Grounds, all of his maintenance staff who have to follow, sanitize, aggressively work in all our facilities, including our operations center. So I want to tip our hats to the maintenance staff. Listen, we are in a state of emergency per the state of New Jersey, and I want to commend the Freeholder Board for as well declaring the county state of emergency, which will allow our emergency management team, led by Mike Opegart, who is one of the best, to move assets, purchase some equipment, enter into mutual aid, and deploy as needed things that we need to do around the county. Now, what does that mean for some? As you know, our operations center, Joint Operations Center, has been open for the better part of over a week with your health department team, our team in law enforcement with Prosecutor Chris Comiccione and his staff, our EMS task force led by Mike Bascom, and of course our emergency management team led by Mike Opegart. All of those resources are in the operations center. Some people, not all, because we don't want to pass it around. We are practicing social distancing in the operations center as well. But all of those people coordinating the effort here and any response to the county. That includes the testing question, which has come up. Obviously, you have heard the governor, who I want to commend his actions, and FEMA with regard to deploying 2 testing sites. One, I know the governor is visiting today up in Bergen County and should be open as a regional testing site for FEMA and the State Department of Health. And the other that they are currently working on at the PNC Arts Center over in Homedale here in Monmouth County, which is due to open next week. I want to stress there is no opening date. Do not drive up to the Arts Center. It is not for public access at this point or testing. So we will let you know in further press releases and announcement when that testing site will be opened by the state and our FEMA representatives. There are some private companies, some medical outfits, the urgent care centers throughout the county, I believe 2 right now, that were approved by the Department of Health and have appointment, by appointment only testing up to 200 a day, and certainly we can get you those addresses. With regard to our EMS task force, some of you may see some deployment of our EMS task force. You will see tents, what are called surge tents, at the various hospitals. Those aren't to alarm anyone. In fact, if I'm looking at my OEM coordinator, I don't even believe we're using them right now. They are in preparation and planning should the hospital see a surge. Right now, as of this morning, all the emergency rooms at the hospital networks are open for business and are not overwhelmed. Of course, we will see an increase of cases. We've had, as of last night, I don't want to go over numbers because numbers are a moving target here with the various health departments, but I know we had 44, which was up from the count the day before. We're going to see that count continue to go up. Testing, positives, all will go up. The main thing here is the cooperation from our residents, and I think the freeholders would agree we are seeing tremendous amount of cooperation from our residents. our parents, their siblings, our neighbors, certainly want to help each other out. I know Freeholder Kiley is working on food bank stuff and resources for those in need, and certainly at the direction of our Freeholder Director, we will serve our residents in any way possible. Again, I want to thank you for that declaration of emergency, which allows us to move those assets and resources around, and thank you, Freeholder.
So as we talked about before, and I want to thank the sheriff and his staff for all they're doing, and I'll continue to close it out with some of the people that we really have to say thank you to. But, you know, I want people to realize, you have to be a realist. This is going to spike. As we go through this testing area, it's going to spike, but that's actually a good thing. That means we're actually finding out who is feeling ill. We're making sure we know, they know, and then they move into a quarantine area and everybody gets better and it doesn't spread as much. So that's a positive side. So as you've heard over the course of the many days, we're going to hit a peak and we're going to hit at certain numbers, which a lot of people, you know, it is a crystal ball, okay? But part of that decision, okay, and analysis, okay, is built on a testing facility. Because obviously, if we're getting tested now, people that are carrying it and maybe not even feeling that bad at this time, okay, that they'll know and they will not be able to transmit it to anybody else. So with that being said, I'm going to bring in probably another one of a very vital parts of our county here, and Chris Merkler, which is him and his staff are working around the clock and giving us the best service this county could possibly ever imagine. And I want to thank him and his staff. Chris?
Thank you, Director. Thank you, Sheriff. Thank you, members of our Board of Chosen Freeholders. I'm going to go over some numbers really quick. Okay. Sorry. I'm going to go over some numbers really quick. Sorry, I'm a little tall. All right. So a couple of numbers, and then I'll just reiterate a lot of things that have already been said. Currently, CDC reports there are 10,442 cases. As the sheriff already mentioned, our current case total in Monmouth County is 44. That number will change, okay? Public health efforts at this time are focused on containing the spread of COVID-19 and mitigating the impact of this virus to the communities. We are anticipating a spike, as the director said, in positive cases as more testing takes place. Public health investigation into positive cases are ongoing. Contact tracing of cases is continuing. To reduce community spread, the Monmouth County Health Department is identifying high-risk facilities, providing guidance for vulnerable populations throughout our communities. We are focusing our efforts on healthcare providers and people who live in nursing homes or long-term care facilities, as they are the most vulnerable. Certain adult day health service facilities have been closed at this time in Monmouth County. In an effort to limit spread of the COVID-19 virus, certain facilities are closed by executive order of the governor. Restaurants and bars are open but limited to takeout and delivery. The director talked about some of those initiatives. Delivery may occur during daytime and after 8 p.m. Supermarkets, pharmacies, medical supply stores, and gas stations are open. All New Jerseyans are encouraged to practice social distancing and avoid large crowds, gatherings, practice good hygiene, and stay home if they are sick, as the deputy director went through. If you are mildly ill, stay home, follow the guidance of your health care providers. If symptoms get worse, contact your health care provider or urgent care center and check with your insurance provider to see if a telehealth option is available to you. If the public has questions, I'll go over the numbers again. They should contact the state call center, 1-800-962-1253. Call center is open 24/7, has multi-language capabilities. Callers who need medical advice should contact their healthcare provider. NJ211 has been activated to assist with handling COVID-19 calls from residents. Residents can also text NJ COVID to 898-211 to receive text information and stay informed. To receive live text assistance, residents can text their zip code to 898-211. County hotline started operating this Monday, March 16th. Hours are currently from 9 a.m. to 8 p.m. Monday through Friday. Individuals who are experiencing physical or mental health issues, please contact the county hotline again, 732-845-2070. Thank you.
Thank you, Chris. So as you can see, this process, and there is a process, and we have to put things into priority, obviously safety being the first and foremost there. Then we have to put in a plan with our staff. Then we have to put in a plan to keep things vibrant in the county. Then we have to finally put a plan to make sure that everybody is being fed properly. We will work next week, along with our administrator, Sue Kiley, Nick Duraco, and the rest of our board here, work together to find a way to be able to filter out to our food pantries here through a county-wide system here, where if we have to mobilize it and find out, get the data from our municipalities saying their needs, okay, that's gonna be another initiative. We are hitting this head on. And I know I'm gonna repeat myself 1,000 times. We do not have a crystal ball. It's just looking, thinking responsible, common sense, and making sure that we do the right thing. And I want to emphasize here, we're coming into a day where it's going to warm up in the course of the day. It's going to be warm over the weekend. It is not spring break. It is not Easter break, okay? And it is not summertime for the children, okay? This is a time, the reason you're not in those facilities is because we here, people behind us and everybody else in the county are asking you to be responsible. Social distancing cannot be more important now than you will ever hear this word being stated, I hope. With that being said, I think right now I will take a few questions, and I would like a lot of those questions, if they're technical questions, to go to our sheriff or Chris Merkler there. So is there any questions? Yes. Okay, yes. So now that we have the data being brought to us, we will, on our website, have the breakdown by the towns. That will be provided. Hopefully, we'll be able to get something up today. We spoke about that just recently. Yes, it will be filtered through Chris Merkler's office. Then he will dispense it through the regional areas, which is some of the regional authorities and some of the local municipalities that have their own health department. And listen, this is not to put a bad blemish on them, okay? But what better way to not have just one message out there and working together as a team? We're asking towns, residents, health departments have to work together too. So, yes. So probably by the next hour here, I will have on our website, on our county website, our SBA disaster program for emergency disaster for our small businesses. That will be up on our website very shortly. The link, let me keep in mind, that is a link to a state agency that our economic development, will assist our businesses with just information and giving them the proper tools to know where to go to. Okay, we will put our resources there, as we did during Sandy, put our resources there so they know how to properly go through that process. So I'm going to close this out now because I want these people behind us to get back to work because that's what's most important. Suzanne, one more question?
Testing centers, I know there's one in Kansas not open yet, there's one in Marlboro. Where is?
I'm going to leave that up to Chris or Sean. We will try to get the list out to you. One last one.
What are the challenges in the operations center with people dialing 911 or trying to find out more information?
The challenges for people dialing 911. Please, Vin, it's a good question, and we've been trying to put that out there on social media. Please, only in an emergency. If you have a life-threatening illness, should you be dialing 911. As you can imagine, our operations center, particularly the 911 center, we've kind of locked that down ourselves. The operators are doing a tremendous job fielding the phone calls. We did have an uptick in the number of phone calls as all of this unfolded last week. That seemed to have leveled off as well with the hotline numbers and the 211 system that has been distributed. So don't call 911 unless you have an emergency. We have altered response plans based on municipality and the local police chiefs. Some police officers in local towns are not responding to non-life-threatening calls. We have additional call screening. That call screening was set up by the State Office of Information Telecom Services that guides our 911 systems throughout the state of New Jersey. So there is additional questioning by our operators going on about flu-like symptoms and then narrowing that down into COVID-19 type symptoms so that we can better prepare our first responders.
Thank you. So in closing, I'm going to leave us with this. So, you know, I'm so proud, and I know my freeholders are so proud of the way we operate here in the county with our 53 towns. And if you look at that, the way we operate, Democrat, Republican, Independent, whatever they might be, okay, we work together as a team. I am asking the Monmouth County residents and quite frankly the state of New Jersey, we need to rally around our president, our governor, all our legislators, your county officials, and your local officials. This is not a time to critique people because nobody has had experience in this. We're all working with the right end game to cure this and get Monmouth County, the state of New Jersey, and our country up and back to what it was our normal way of life. So I want to thank everybody for coming. We will continue this process. If I have to be here next Friday, I'll be here next Friday. But we'll continue to make sure that we dispense all the information that our residents here need in Monmouth County. So thank you and be safe.